Yeah, man, about this roof. The diaphragm. The diaphragm is linked with three mesothelial surfaces. As a matter of fact, four mesothelial surfaces, the diaphragm. What are they? What are the mesothelial surfaces that the diaphragm is connected with?
Septum transverse. One.
As yet? Alright. Big surfaces, man, associated with the diaphragm. Big surfaces. Can put your whole hand on top it. Whole big hand can go on top it. Big mesothelial surface associated with the diaphragm. Think about the pleura, the parietal pleura. What that make up? Not mesothelium. Hmm? Come on, man. You tell me what you get A in respirator. Huh? And 3 months later, you can't even answer a simple baby question. Simple nurse question. Alright, so we have a big parietal pleura, right and left. And then we have another big surface, the pericardium. Pull the heart out, the whole inside there. Pericardial cavity, not a big mesothelial surface. And then we have the big peritoneal cavity. Huh? And you couldn't even give me one. Ah, boy. So, now we have 1 and 2, which are the right and left pleura. Then we have the pericardial cavity. And then we have the big peritoneal cavity. How many more you want more than that? That's 4.
You have one more surface, but it is not epithelial line. What is that?
One more surface, but no epithelium on top of it.
Of the liver, which has the connective tissue of the liver, the central tendon of the diaphragm, and the diaphragmatic pericardium. They all develop from one structure called septum transverse. So that is the area which is connected to the vein area of the liver, has no epithelial lining there. And that's another surface. That is
All right.
anterior surface
Of the.
opposite the pericardial surface.
Don't forget that. So we have the bear area, but the bear area is not a mesothelial surface. Right? But that struck a very important note, because the diaphragm, what contributes to the diaphragm in terms of the formation of the diaphragm? What forms the diaphragm? Which is the roof? Which is the roof of this retroperitoneum? Now, careful. I didn't ask what is the nerve supply to the diaphragm. You know, some people answer a question, but it's not the question that was asked. And they answer a right question, but it happens to be, it's like you get a composition to write, and they just make up their own thing on what to write. You know, they're going to get 0. Yes, you're like Job's friends. You're talking some truth, but it is not relevant to the situation. All right, so give me the origin for the diaphragm. Sorry? Septum transversum. That's one that was mentioned. That's septum transversum. Anything else? Yeah, mesoderm is involved in it. What else would we need to form the diaphragm? What happens to them big canals on the side, man? Pleuroperitoneal canals, yes. Yes, they contribute laterally to the formation of the diaphragm. What else? Mesentery around the aorta. Mesentery related to the esophagus. What else? That thing has gone from you, boy. Gone from you. The peripheral part of the diaphragm, what produces it? Peripheral myoblasts. Yes. Peripheral myotomes, peripheral myoblasts. Yes. So all of these are contributing to the diaphragm. Alright? So in terms of the attachment of the diaphragm, what are the structures that help in forming attachments with? What supports it? Diaphragm could just be a muscle in thin air. You know, it has to be attached, so it can increase your tidal volume, increase your TLC, the total lung capacity. You look as if you're getting tired. Yeah, you look as if you're getting tired. Yeah. But tell me what is attached to the diaphragm, and the next class we'll continue with the rest. So you get to go and increase your glucose load. What's the diaphragm attached to anteriorly? To the what? Anteriorly, what is it attached to? To the what? The sternum, posterior part of the sternum, and then laterally to the costal margin, and posteriorly to the what? What posteriorly forms a kind of attachment for the diaphragm? You need some legs at the back. You don't need some legs at the back. You don't need some crura. That's what crura means, legs. Yes. Cross left and right. So we need some crura. What are those crura going to be attached to? L1, 2, L3, and L1 and L2 on the left. Right, so don't forget those. Now, sometimes there are some defects. The baby is born and had a baby like that, the baby born normal, and then at the hospital, and then nurse called me, I think the next 2 days or so, tell me the baby is dead. Baby is dead. Baby born quite okay, and then baby dead. So what I have to do? Post-mortem. So I open up the baby's chest, and when I look inside, in the chest I'm supposed to find lungs. But you know what I find up in there? Bowel. Bowel up there. Bowel in the lung. Bowel inside the thoracic cavity. The baby had a huge something that caused all of the intestine to go up in the chest. What the baby had? Herniation. And there are 2 places where you get the herniation. Commonly, where are they? On the left side, one of the back the leg, and an anterior one, Morgagni's foramen. Okay, so we can have those 2 defects. Don't forget them. They are related to the roof of the posterior abdominal wall. All right, we're going to leave there, and the next time we deal with the rest of the retroperitoneal system.
That's so wrong.
Which group were in Vietnam? 8 this morning. For the serious meetings. Oh, scared to tell you what it is. So, that's all right. I think he is. It's not in that. But my name is
That group of people there, the people there.
that's from last year.
Oh.
I don't know. What is that again? Status there button. That's start for the desktop today, Windows 8. Give me a what is it? A fancy thing, you know. Yeah, look. Oh.